Okay, so this time for percussion, we're going to use our ears. We need to listen to the percussion sound. Okay, so for the lungs, the percussion sound, it should be resonant all over. Okay, so what we use is, you have your pleximeter. So your pleximeter is the one on the surface, while your PLEXOR is the one you use to hit. So, well, you can use any side, no? But it depends on your dominant side, no? So I am left-handed, so I use my left hand as my PLEXOR and my right hand as my pleximeter. So this is how you're going to place it. So you start at the, here at the supraclavicular area. Okay. So your pleximeter, only the middle finger should be touching the surface. As much as possible, all the other fingers are off the surface. Because if you're going to put it in contact, it will dissipate the sound. So you have to only have your middle finger on the surface. And then your target should be your distal interphalangeal joint. Okay. Now your PLEXOR, it should be positioned this way. Okay. And your PLEXOR, you use only your middle finger to hit. So you do it this way. So it should be in cock position. So it should be parang nakakasa, no? And then the force should be in the wrist. So ganun dapat. Okay, hindi ito, hindi parang kumakatok. Dapat dito nang gagaling yung puwersa. Okay, so start from the, so you need to produce the sound. Okay. Okay, then go to the intercostal spaces. Okay, so let me do it without gloves, so that it will really produce the sound. So that's the sound. Okay, then go to the intercostal spaces along the mid-clavicular line. Okay, can you hear? So that's the resonance. Okay, so take note that when I did it from the apex going down, I did it in a step ladder manner. So you can either do it this way, then go to the other side, then down, or you can do it in zigzag manner. So you can do it that way. So important thing is you have to cover both sides. Okay, so that is your, the normal percussion finding is the lungs are resonant all over. Okay, so of course sometimes you will hear some certain dullness, especially if you are at the silhouette of the heart and at the liver area. But generally, so in those areas there will be a transition of sound from resonance to dullness. But in majority of the lung fields, it should be resonant. And then there are other percussion sounds that you may hear, which may indicate the presence of air, like in patients with pneumothorax, or you can also have dullness if there is the presence of liquid in pleural effusion, and if there is consolidation in pneumonia, there will be dullness on percussion. But generally, the normal lung should be resonant on percussion. Okay? Then we ask the patient to do it again. As I mentioned, you always do at the anterior and then go to the posterior. So, again, so close your, cross ulit yung kamay mo. So this is to open up the scapula, interscapular area. So again, you start from the apex. So that's why for females, you need to cut your nails short. Kasi kung mahaba ang kuko nyo, masusugatan kayo, or pagka na-miss nyo yung target, masusugatan or masasaktan yung pasyente. So make sure that your fingernails are cut short. Okay, so you see the force, and then my target is the distal interphalangeal joint. Now if it's, then you percuss in the interscapular area, not in the scapula itself, because it will dampen the sound, the presence of the bone. So you have to be, it has to be in the interscapular area. Okay? Okay, can you hear the sound? Okay, when you reach the base, you go more laterally. Also in front, at the anterior aspect, if you are already at the base, you go more laterally, so that you will cover the basal areas of the lungs. Okay? Okay. So that's